So good afternoon, Representative Ferguson. Thank you so much for joining us for this month's NCOIL one-on-one interview. So to begin today, I'd like to start off by asking you what first brought you into public service, and when did you first get involved in public service?
Well, I didn't run for office until 9 years ago, but certainly I was very involved in the community for a lot of years. I have 3 children and I practiced dentistry, and I was involved in a lot of community projects on a lot of different levels. I guess my first really connection with government, when I was a dentist, I had 2 children who ran away from home, and my dental office was the closest and safest place I guess they knew. They'd been sexually abused and neglected, and I spent 6 years in the family court system with them, working as their guardian ad litem, and ultimately they were adopted by the foster family. But that was a real eye-opener for me, to the family court system and all of the foster system. So that was what drew me to politics. But my husband's family had always been very involved in politics too. My father-in-law, who's 103 now, was Speaker of the House and was in the same seat that I'm in for 34 years. And my mother-in-law was actually, back in the 70s, the first mayor of a first-class city in Arkansas. So I had been on the periphery of politics for a long time.
Okay. And then what issues were you initially involved in?
Well, certainly issues with healthcare and family and children's healthcare and those kind of needs. My whole family is somewhat involved in healthcare. My husband's a physician. My daughter's a physician. I have my sister-in-law is a nurse. My nieces are nurses and work in NICU. So healthcare certainly.
Mhm. Okay. That's great. And then how would you say that public service impacts your personal life?
Well, it's very positive. I really, my children were grown, but when my husband was a state representative, I was very reluctant because he ran and was a state representative as well. And I thought being away from home and away from the family was really going to be a negative thing, but it really turned out to be very positive. Our children are all very politically engaged and keep up with current events and working campaigns. And it is really, I saw through that how it really enhanced all of our lives and made us more committed to our communities.
Yeah. Were you and your husband ever representatives at the same time?
No, he was a representative. We had term limits. It started in Arkansas in 92. And so he was a representative for 4 years back in the 90s. And of course, I didn't run until 9 years ago when I retired from my dental practice.
Right. Okay. So how did you first hear about NCOIL?
Well, I was vice chair of public health, and the chair of public health was a very good friend, and he invited me to the San Francisco meeting. And I really didn't know what to expect. I just sort of went because I was friends with him. He said, I think you'll enjoy it. Let's go. And I went to the Griffin Institute at that meeting, and I was just so impressed and so aware of all of the other forms of insurance that I really was not familiar with. I was very familiar with healthcare and health insurance, those issues, but I strongly recommend that to anyone that's starting NCOIL or just any representative. It is really a very good introduction to all forms of insurance.
That's great. And then since you've been involved, how would you describe your overall experience with the organization, with NCOIL?
Well, obviously, I think it's very beneficial because I've continued to be involved.
Right.
I really appreciate that it's very nonpartisan, that the focus is on policy. And they bring in great people, and the staff really make sure that the meetings are very efficient. I don't want to spend my time or waste my time when I go to a meeting with, unnecessary things. So I really appreciate that the meetings are very efficient and very informative.
Definitely. That's great. So your professional life outside of NCOIL was as a dentist. Do you think this perspective has had an impact with your experience at NCOIL?
Well, certainly. I still have colleagues in dentistry, and I'm have a good relationship with the American Dental Association and the state association. And I advocate for a lot of their bills at the state level. And I actually had a model bill at NCOIL last time for, representing dentist transparency and pricing. So yeah, certainly it enhances everything I do in the health. I'm vice chair of the public health committee in the state, and I'm on the insurance committee, and then I'm co-chair of the insurance exchange committee. So all of those issues come up in relationship to dentistry and all healthcare.
That's great. So what would you say would be the most valuable takeaway from being an NCOIL member?
Well, the relationships. I think the relationships you form and the things you talk about in the hall and you talk about at dinner are just invaluable to understanding the problems they have with passing bills, what issues come up, the relationships, and then the information. Like I said, they have great speakers and really run efficient meetings. And I gain a lot of policy information to, weigh both sides of issues at the meetings.
Great. So for those legislators out there thinking of maybe joining NCOIL, maybe on the fence, what would you say to them? Why should they join? Would it be those relationships? Would it be, something in addition to that?
Well, I think it's everything. Like I said, I've served on some other national committees with other organizations, and NCOIL really is just, it's a very collegial atmosphere, and I enjoy the relationships with other representatives that certainly, have served longer and know more about insurance than I do. But I do appreciate that it's very nonpartisan too, and it's policy driven.
Definitely. How about for those out there that are non-legislators, so consumer reps and industry reps, what would you say the benefit would be for them for attending these meetings?
Well, I think the benefit goes both ways. I mean, we have an opportunity to hear about their issues and their perspective on things, which is really great. But that goes both ways. It's an opportunity for them to get to meet with a lot of legislators from states who are leaders in their state on insurance committees and advocate for their position.
Okay, and then during your time with NCOIL, what committees have you chaired? And what would you say are the benefits of being a chair of a committee?
I served as the Life Insurance and Financial Committee, and then I chaired the Bylaws Committee, and now I'm vice chair of the Health and Long-Term Care Committee. Really, the staff makes it so easy to be a chairman. They really, have everything laid out, have the speakers ready, and make it very efficient. So I'm not sure there's a great deal of advantage to being a chair. I mean, they make it pretty seamless for you.
Okay, that's good. Good to hear. So this past year, how has COVID-19 affected your experience with NCOIL? Did you have different expectations for the past year? I know you've attended some of the meetings virtually. Has that had an impact on your experience?
Well, it's certainly, it's not as good as meeting in person. It's, I mean, I'm glad we've done it. I mean, I would have rather done Zoom than not met at all. Right. But I'm anxious to get back to meeting in person this summer. One advantage I have seen, though, we've had some international speakers on Zoom that I'm not sure we would have been able to acquire to get to speak on issues and get them there in person. So I think that's something we should continue to allow certain people that are, from England or especially on international issues to be able to testify by Zoom.
That's great. All right. So do you have a favorite model law that NCOIL has passed during your time with the organization?
Well, I was very proud of the balance billing bill. I really think it's very important when people are out of network to hold the patient harmless and make that a decision between the insurance carriers and between the insurance carriers and the hospital or the provider. I think when you bankrupt people for balance billing, that's a bad thing. And I do think the balance billing bill that we passed laid the groundwork for the federal bill that passed in December. I see that a lot. Things happen in the states first, and then takes a while for that to happen at the federal level sometimes.
That's great. All right, so to wrap up today, I just want to ask you a couple of extra questions so everyone could get to know you a little bit more on the personal level. So if you had to choose one favorite all-time movie, what would it be?
My Best Friend Wedding. I love Julia Roberts.
Oh, I like that
romantic
movie too.
I love all romantic comedies.
Yeah, agreed. All right, favorite book, or if you're not a reader, favorite musical artist?
Oh no, I'm a reader. It's hard to choose a book, but my favorite book of all time is called A Fine Balance. It's about it's about India and the time of Indira Gandhi. It's a great book by a Canadian author back in the 70s. It's one of my favorite books. Music, I love the Beatles. I love Paul McCartney. I'm from that era.
Okay, good answer. Favorite TV show?
Oh, I don't know. Law and Order. I like all the Law and Orders. And also, I love Saturday Night Live. Saturday Night Live premiered when I was in college, and I've never quit watching it since. So.
Wow. Do you watch it every Saturday night?
I record it. I've gotten too old to stay up and watch it, but I watch it after I've saved it.
Mm-hmm. All right, then last question. If you could have 3 people over for dinner, living or dead, who would they be and why?
Oh me, that's hard. There's so many. I think living. I think inviting dead people's kind of creepy. So Oprah Winfrey, obviously. She's interviewed everybody. I mean, I would love to. I hope she writes a book someday. It would be a great book. Christine Lagarde, head of the International Monetary Fund. I mean, she's been there forever and just one of the most powerful women in the world. Of course, I love movies. Like I said, we're a big movie family. Maybe Catherine Bigelow. She's the director that's just really laid the groundwork for lots of women in the field.
Okay, that's great. Those are really good answers. So do you have anything else you would like to add? Any last piece of advice or anything you want to talk about in regards to NCOIL or your professional life?
Well, I just would encourage more women to come and be a member. There are a lot of men and they have background in the insurance industry, but even if you haven't been an insurance agent, I think women have a lot to provide in terms of another perspective. And I really just would encourage more women to come.
That's great. I agree with that. Well, thank you so much, Representative Ferguson. It was so great to hear from you today and looking forward to seeing you in Boston.
Yeah, I look forward to seeing everyone in person again.
Definitely. All right. Have a great day.
Okay, thank you.
All right. Thank you so much.